episode of Has lecture series. Today is a great Wednesday. Why great? Don't know. Anyway, so I'll be discussing about excretion of drugs. It's again an important component as far as clinical pharmacology is concerned. We have done something on elimination, metabolism. So now let's see what happens with excretion of the drugs. If you are new to my channel, you can always subscribe to my channel by clicking the button above. You can visit all my videos on my lecture series on metabolism, elimination and so on. So yes, excretion of drugs. So whatever goes inside the body has to come out. You will all agree with me. Food, okay, comes out as feces, except the fat component which is stored. I'm not to talk in obesity terms, okay, forget it. Water, yes, water comes out as urine, portion of that, definitely. So do drugs, you all have taken drugs at one time or the other, isn't it? For small illnesses maybe till now. It's not that the drugs are going to be inside my body for lifetime. It cannot happen that way. It has to go out of the body. So this process of excretion, okay, from inside to outside of the body is what we call it as excretion of drugs. So many organs do take part in excretion of the drugs. The first would be liver. Yes, liver is an organ which helps in the formation of bile. So in the bile we have the phase 2 metabolites. Phase 2 metabolites, we already learned it in our metabolism. So these metabolites are conjugated with glucuronic acid, so they are excreted in the bile. So drugs do get excreted as conjugated form in the liver and with the help of the bile. Now drugs with higher molecular weight usually are the ones which do get excreted through the bile. Drugs which are lipid soluble again also are happy to get excreted out of the bile through the liver. And but there's an important fact. Once the things are in the intestine there are bacteria. We try to deconjugate. Conjugation in metabolism, forget that, deconjugation now. So they try to split up. They try to split up glucuronic acid from the drug. The free drug is once more available and it gets absorbed into the blood and is kind of enter hepatic circulation as you can see it on the screen. So it increases the life of the drug within the body. Okay, that's important. Some drugs also do get excreted directly into the intestine. So especially heavy metals, they get excreted directly into the intestine. Through the liver, maybe macrolide group of antibiotics like erythromycin, some tetracyclines, and steroidal drugs, oral contraceptives, to extent get excreted through the bile. So it's an important channel for excretion of the drugs. Now apart from the liver, lungs, yes, lungs also help in excretion of the drugs. The best example would be ethyl alcohol, the pleasure drink. Okay, the pleasure drink. You have those alcoholics and it smells bad the next morning. Okay, so the reason is that the drug is getting, alcohol is getting excreted through the lungs. The forensic side of it is, you see those policemen, if you are a party going individual, definitely, I'm not at this age, but I was a few years ago. Anyway, you get caught up on Friday nights, driving very fast and come across those breath analyzers where they try to extrapolate the amount of alcohol within the breath with the amount of alcohol within the body, and then see whether it matches to the levels, the legal levels and so on. So yeah, we take the help of excretion of drugs for forensic purposes, especially ethyl alcohol. General anesthetics, the gases which are used for anesthesia again get inhaled and also exhaled. So again excretion through lungs, that's again an important factor or important organ of excretion. Then all of the secretions, I should say, saliva, sweat, semen, do help in excretion of drugs. The best example of that should be anti-tuberculous drug like rifampicin. Okay, rifampicin is kind of orange color tablet. It imparts that color to the secretion. So patient gets panicked out and may come to you running. Okay, what's happening? My secretions are turning whatever orange in color or reddish in color. sweat, saliva, semen. What's happening? In fact, it's nothing. It's just the excretion of the drugs that is causing all these problems, or the discoloration of this secretion. So that should be totally counseled to the individual before the drug is given to the individual. Again, females, we talk in terms of lactation, milk. Yes, milk is an important factor as far as excretion of drugs is concerned. Milk is slightly basic in nature, okay, so maybe more basic drugs tend to concentrate within the milk. Again, lipid soluble agents, drugs which are protein bound free, so free drugs are the ones which will get into the milk very easily. Now the major concern is that drugs which are given to the mother should not reach the child via the help of the milk which is been taken up by the child. In the form of lactation. No, it should be inhibited because the child may get some adverse drug reactions which are unwanted. So it's an indirect kind of trauma to the child. We do not want it to happen, especially with GIT. So GIT discomfort is the most commonest, especially if a mother is taking any of the drugs. Again, higher order chemotherapeutic agents, then whether to lactate or not is again an issue. And you will see those drug information booklets available with the drugs, and it's clearly noted whether the drug is safe for lactation and not. So that's important to see clinically before giving any drug, especially in pediatric practice, which drugs are safe for lactation, which are not, and so on. So that's something which is point to be noted when you talk of excretion of the drugs. The last and the most important organ of excretion is definitely the renal system. Kidneys, yes, are the key components when you talk of excretion of drugs, isn't it? Because they are the excretory organs of the body. When you talk of kidneys, we talk of the functional unit, that's the nephron. Nephron has glomerulus, and then we have so many tubules which go on and which form ultimately help in the formation of urine. There are three processes that usually are concerned when you talk of excretion. We talk in terms of glomerular filtration. First, glomerular filtration. You know there is a glomerulus inside which there is a capillary bed, and drugs which are basically free, so they are not protein bound. Drugs which are, I should say, water soluble drugs which with I should say low molecular weight, medium to low molecular weight, get out of the glomerulus very easily. So glomerulus, if you talk of the filtration rate, it's around 120 ml per minute, roughly around that. I don't know exact value, but roughly around that. So a huge amount of fluid is driven out of the glomerulus. So it's that most of the drugs do get excreted out through the glomerulus. That's what is important. But drugs which are charged again, which have a charge on it, may not be the ones which get out of the glomerulus. Again, drugs which are more protein bound, there's that's inhibiting or limiting factor for it to get out of the glomerulus. Anyway, whatever is the case, most of the drugs get out of the glomerulus in the form of glomerular filtrate, and that's important first step when you talk of renal excretion of drugs. But whatever goes outside, 99% gets reabsorbed. It cannot happen that with such a huge glomerular filtrate rate, all the fluid may be driven out of the body within a few minutes. It cannot happen that way in nature. The body sustains itself. So there has to be some other process. That some other process is tubular reabsorption. So whatever goes outside, 99% of that is taken back within the body again. So drugs which are, I should say, lipid soluble, drugs with no charge on them, so unionized drugs, are the ones which are easily taken up back by the body. This is again a kind of passive diffusion which is usually occurs when you talk of tubular reabsorption. That's something that you need to know. But again, I should say drugs basically drugs are usually weak acids or they are weak bases, either weak acids or weak bases. So you alter the pH of the urine, it might change the scenario. It might change the scenario as far as excretion of drugs is concerned. So weakly acidic drugs become more ionized. Ionized is nothing but they will carry more charge on them, plus minus charge on them, whatever it might be, in a basic environment. So weakly acidic drugs become more ionized in basic environment, and basic drugs will become more ionized in acidic environment. Exactly reverse of what happens with each other. So you need to remember this concept. Okay, once more ionized means there is a limitation for how much it can be reabsorbed. Because it's having a charge on it. These charged molecules cannot go from one side to the other side. The charge will limit their movement. So weakly acidic drugs like barbiturates or salicylates in kinds of poisoning, you want to drive these drugs out of the body. Try to make the urine more alkaline in nature by giving sodium bicarbonate or any other alkali. Try to make the urine more alkaline in nature, so that these drugs will become more ionized. They will carry more charge on them, so they cannot cross from the tubular lumen back to the body, and these drugs will be driven out of the body in a very efficient way. So this is one of the ways you tackle over poisoning with acidic drugs, especially salicylates and barbiturates. Again, we can do it if we talk in terms of acidic drugs, in terms of basic drugs, but again, making the pH more acidic might harm the body. So we do not do it the reverse way usually. Clinically, it might be difficult to control the scenario. But making the urine more alkaline is a common practice, especially when you talk of these drugs and so on. The last of the processes when you talk of excretion of drugs is definitely tubular secretion. So apart from that global filtrate reabsorption, we also have something called as secretion, active process going on where substances are actively secreted within the urine of an individual. These secretory proteins require energy and are present especially within the tubules of the nephron, and these help in secretion of the drugs. We have acidic transporters, we have basic transporters, which do help in actively secreting drugs from the blood to the lumen of the nephron. Acidic transporters, examples for drugs using these transporters would be drugs like penicillin, probenecid, whereas basic transporters would be drugs like thiazide and so on. So these are some of the examples. Again, a clinical relevant example of that would be probenecid and penicillin. Probenecid and penicillin use the same acidic transporter medium. Okay, so if you give probenecid, it tries to competitively block the transporter so that excretion of penicillin does not occur. Okay, it competitively blocks the transporter so that excretion of penicillin does not occur. What do you mean by probenecid would actually try to gang up onto the transporter. It tries to gang up onto the transporter so that it actually blocks it, so that penicillin comes for excretion, there is no place for it to join to the transporter and get out or into the lumen. So the levels of penicillin remain in the body very high for a very long time, so it increases life of penicillin within the body. So that's the help. Okay, so you use two drugs in combination to increase the life of penicillin. Okay, by using a drug like penicillin, by using a drug like probenecid with penicillin. So that's one of the examples. Again, you have so many other examples where the same mechanisms do play a role, where same pathway blocking the pathway increases the chances of other drugs in the body. Kind of a competitive blocking mechanisms that exist when you talk of tubular secretion. That was about renal systems that one needs to know. Again, a few other organs, minor pathways would be intestines. So a few drugs are directly excreted in intestine, especially heavy metals and so on. So need to know about that also, that they do get excreted directly from the intestine within the lumen, and are passed out in the feces. So that's again a minor pathway as far as excretion of drugs is concerned. Now we talked of so many mechanisms: renal, liver, lungs, saliva, sweats. Again, coming back to intestine and so on. Remember that these excretory mechanisms require some time. So it's not that at birth everything is optimum. No, it's not working optimum. Requires some time to develop, and after a certain age it tries to deteriorate. So as a person grows old, maybe the blood flow to the kidneys drops down, GFR drops down, and the excretory process itself is delayed. So extremes of ages again is a point where one person, whether a health professional, should be very careful as far as excretion of drugs is concerned, because it may not happen to that extent as what happens in adult human beings. Drugs can just accumulate within the body and can cause adverse drug reactions in these extreme ages at therapeutic doses. So that's clinical implication when you look at the age. Again, levels of proteins. Yes, we require proteins for binding of the drugs. If levels go down, free drug is available. More free drug is available within the bloodstream. This free drug has more chances of getting out of the body. Okay, so more excretion if more free drug. So the levels of these drugs might drop down if a person is suffering from any of the hypoprotein levels in the body. Causes might be anything. For low proteins, we are not concerned with that. But people with malnourishment, people with less protein in the body, in the blood, plasma, and drugs might get excreted out quickly as compared to the normal individuals. Again, disease states. Okay, persons with kidney problems, person with liver problems, excretion of drugs might be an issue. We will come to it of how to calculate doses of drugs with people with kidney problems, liver problems, and so on in the sessions to come. But please bear in mind that these drugs, these conditions do have implications into how the drugs are excreted out. So you need to be very careful while selecting the drug, while selecting the dose, and while selecting the regimen to look at the renal function test as well as the liver function test of the individual. If there is a dearrangement of these function tests, maybe you need to select another drug or might need to change the dosage schedule, the dosage regimen, and so on. So that was my short quick analysis on excretion of drugs. I hope you like my session. Do keep watching my channel. Description do matter to me. I need to continue on with that. Thank you. Bye.